Good afternoon again, everyone. And I know everyone is excited to begin our today's session. So without further ado, I would like to introduce to you our master speaker for today. So he is co-listed with Bill Gates and the world's great achievers in the 25th edition of Marquis Who's Who in the World. He is an author of Mosby, Elsevier, and Jones and Bartlett Publishers USA. He has over 25 years of teaching and administrative experience in test preparations, including graduate and undergraduate nursing programs. He was named one of Go Negocio's first 50 inspiring Filipino entrepreneurs and the Philippine Graphics Magazine's 2006 Young Leaders of the Philippines. He received the MVP Bossing Award for Education, the Agora Award for Entrepreneurship from the Philippine Marketing Association, the SME IT Award for Innovation from the Philippine Internet Commerce Society, the 10 Outstanding Filipino Entrepreneurs from Entrepreneur Magazine, and Young Market Master for Entrepreneurship from Mansmith and Fielders. He was accepted as a member of the Ernst and Young Entrepreneur of the Year Academy. Currently, he serves as a trustee of the Philippine Center for Entrepreneurship. He is a recipient of 2 doctorate degrees from the 2 state universities in the country, the Ramon Magsaysay Technological University and the Pangasinan State University. He finished his Bachelor of Science in Nursing cum laude and Master of Arts Nursing summa cum laude at the University of Santo Tomas. He was a board top-notcher in the Philippine Nurse Licensure Examination, where he obtained a rating of 89.20. He obtained his post-baccalaureate certificate in e-learning design and Master of Education in Learning, Design, and Technology at the Pennsylvania State University. He finished both courses with a grade point average or GPA of 4. Ladies and gentlemen, let's welcome Dr. Ray A. Gapuz.
A pleasant afternoon, colleagues, and thank you very much, Ma'am Riza, for the very comprehensive and kind introduction. But let me add on to that I have monitored NCLEX RN tests for more than 25 years and have taken it at 3 different times in 3 different venues and passed them all. And so therefore, if you would ask me, when is the best time to take the NCLEX? I'll give you some factors to consider so that you will be able to take it at the best time when you're perfectly ready for it. Hindi ba natin naiisip, why do we have 2 schedules for the NCLEX? One morning and one afternoon. People would just actually use it as a basis of convenience for scheduling. Ay, hindi ako pwede na umaga hapon na lang ako. Ay, hindi ako pwede na hapon umaga na lang ako. Little did they know that that was designed based on the research of H.L. Dunn. Anong sinasabi ng research? That 55% of adults as learners have their minds more receptive in the morning, and 27% have their minds more receptive in the afternoon. And the remaining 18% have their minds more receptive either in the morning or in the afternoon. And there was this lady who kept on taking the NCLEX for 9 years in the US and kept failing it. I mentored her when she took her local licensure, and she went back to me, she came back to me, visited me in my office in Baguio, and she said, "Sir, can you create a program for me?" And I said, "Okay. Let me just ask you a few questions." And one of the first questions I asked her is that, "How did you schedule your test?" And she said, "Sir, I always take it in the afternoon kasi lagi ako nauubusan ng morning slot." Okay, let me give you a test and let's find out whether your mind works best in the afternoon. And lo and behold, after the assessment we did, we found out she was a morning test taker. So she is best suited for the morning schedule. Okay? And so what I did, I gave her actually a new program that focused on her strengths in the morning. I asked her to take the test in Hong Kong, preferably with a morning schedule. Sabi ko, sure ka na ba na susundin mo lahat ang payo ko? Sabi niya, sir, it took me 9 years trying to pass the NCLEX while in California. I have to come and visit you. And I said, okay, kung naniniwala ka sa sinasabi ko, go, gawin natin. And then, sabi niya sa akin, basta sir ha, promise mo sa akin, after 1 month, babalik ako sa Amerika, USRN na ako. Sabi ko sa kanya, ano kala mo sa akin, diwata? Stroke ng magic wand? Eh, okay na? But that did not deter us from pursuing our goal, which is to make her earn the 4 letters after her name, USRN. So, pumunta siya ng Hong Kong. After 3 days, bumalik siya. Sabi niya, Sir Ray, took me 9 years to realize. Her name, Geraldine Banzon. Ang kailangan ko lang pala ay for me to take the test in the morning. That's just what I changed in what she was doing. She was doing everything right until she did not realize she's a morning test taker. You need a learning scientist to help you do that for you. And that's one of the things that we would be talking about today. But of course, I cannot tell you what type of test taker you are, whether you're a morning or an afternoon. You can do it either in the morning or afternoon through this Zoom activity. But at least you will gain an insight that NCLEX preparation needs attention. It is not a job for newcomers. When you learn, you have to learn from those who have had experiences dealing with the test, because the test changes. And it is not something that, as everybody thinks, that it is highly predictable. Nuh-uh. And this is the reason why we're doing this. And let us thank Health Carousel Philippines for bringing this program to all of you. I'm Ray Gapus. I'm an NCLEX mentor for more than 25 years. And I would like to invite you to check out my YouTube channel. It's called Gapus Mentors. And I serve there as your fact check buddy. Don't forget to read the check mark between the words fact or buddy. Otherwise, it doesn't sound good. So let me therefore share with you the things that we are supposed to be talking about today. So that's me, your fact check buddy, at your service. Those of you who are ready to take the test, say yes, I will become a USRN. Go! Yes, I will become a USRN. Type it on our chat box. Those who will type will shut down the NCLEX at a minimum number of 60 and will pass the test. Yes, I will become a USRN. And everybody say, I believe I will pass. Okay? Say, I believe I will pass. Oh, di ba? Binago na natin tono. I believe I can touch the sky. Every minute, every night and day. Okay, so let's begin. What's up? This is a very good activity by Health Carousel Philippines. We have to give them a hand. Come on, everybody. Give that virtual clap to Health Carousel Philippines for bringing this program to you. It's not every day that we get to learn that our test taking is indeed affected by a lot of factors, including the scheduling of our tests. Okay, so let me begin by sharing with you an email I just got from one of those I mentored. And she says, Dear Mentor Ray, good evening. It's really an honor for me receiving a message from you, being a highly respected and known mentor in the world because of your knowledge and being a good person. Thank you so much. I would like to say thank you for sharing your knowledge, which helped me pass the NCLEX RN exam. Your strategies in teaching quick fix sessions, you have that. We have more than 200 videos, including close to 20 quick fix session for the NCLEX RN in my YouTube channel. I watched them all. So that's how she prepared for the test and digest everything. It almost became my prayer every day, like merely saying your functional concept while I'm I'm pacing back and forth inside our house, and even made my mother stare at me wondering what I was doing. That's how dedicated I am when it comes to your functional concepts. Mentor Ray, you are really a legend. Okay. Tuwa naman ako sa legend. Now a legend, tomorrow a superstitious belief. Ganun na ba yan? Okay. Your quick fix session. Your quick fix sessions. ABC and 311 books. I read them all by heart, and it really helped me to understand easier every topic. It's like all contents of any nursing books are summarized and shortened in an easier and more understandable way through your strategies and books. Moreover, I'm blessed that I learned a lot from GAPUS knowledgeable professors, Ma'am Kai and Ma'am Jem. May God bless you more and the whole GAPUS family. I'm totally blessed and proud being a GAPUS baby. Respectfully yours, Daylene Bolian Bilangel. And she joined Health Carousel after she passed the NCLEX. And she got to know Health Carousel through my YouTube channel. So, way to go. And I made a referral directly to Ma'am Connie. So, everybody say, I'm next and I believe I will pass. Go. Everybody say, I believe I will pass. Go. Type in the chat box. Those who will type it will shut down the NCLEX at a minimum number of 60 and pass the test. I believe I will pass. Everybody say, I believe I will pass. I believe I will pass. Okay? That's the most important thing that you have to remember. Here's another message from Kai V. I'm so honored. Sabi niya, Hi Sir Gapus, silent follower niyo po ako. Bumili ako ng book niyo, ABC in Passing the NCLEX. At nanood lang po ako araw-araw ng mga free videos mo sa YouTube. Accommodating din ang staff dahil napadalan ako ng email ng mga PDF copy. True, we're giving the PDF copy of my PowerPoint presentation for free. You just send us an email. Para habang nanonood ako, meron akong hawak na lectures. Self-study lang po ako at working din kasi. Marami ako tinry na panoorin sa YouTube and na mga review, pero sa inyo pinaka nagustuhan ko dahil madali ko maintindihan. That's what I'm saying. What is the best review for you? Don't imitate what a friend did because all of us are unique learners. The best review for you is the one that meets your need. Okay? So walang best option yan. Hindi pwede yung ginawa ni Pedro, gagawin mo rin kung ikaw ay si Tomas. Magkakaiba tayo ng mindset. At huwag na huwag kang gagamit ng dayuhang pamamaraan. Okay, why? This is the reason why a lot of Filipinos are failing the NCLEX. They're using Western tools. Those are formulated based on Western mindset. Magkaiba po ang worldview ng Westerner sa Easterner. Tayo pong mga Pilipino ay Easterner. Iba ang pamaraan natin para matuto. And that's the reason why I always make it a point to individually mentor my students to ensure that they will pass the test on their first try without any difficulty at all. So sabi niya, mga 3 months po ako nag-prepare dahil working rin at ito lang po ginamit ko to refresh my knowledge. Look at this lady, okay? Nanood lang ng YouTube videos ko ng 3 months. Sabi niya, I passed the NCLEX exam. Her testimonial is giving me goosebumps last May 24, 2021. Thank you for helping Filipino nurses achieve their dream of becoming a USRN. I love my job. I'm receiving a lot of emails like this from foreigners, Filipinos, and whatnots from all over the world telling me they like what they see in my YouTube channel. And most of them are taking the test. Just today on my lunch break, somebody from Ivory Coast wanted me to create a program for her because it has been 5 times already that she's attending international westernized programs and she's unable to make it in the test. And I have somebody whom I mentored, he doesn't speak perfect English, and it took him 9 tries and he has yet to pass the test. We did a mentoring, watch my YouTube video. After 4 months, he passed the test. So, wala yan sa kung saan ka nag-review. Nandun yan sa pag-a-acknowledge na yung ginagawa mo bagay sa iyo bilang learner. Okay? So, everybody again, say, I believe I will pass. Go! Type it down again para ka pumasa ng minimum ng 60 items. Okay? At you will shut down the computer immediately. Okay? Hindi po totoo na nag-shutdown ng computer at 50. Pag nag-shutdown ng computer at 50, ibig sabihin nag-brown out. Okay. Eto naman from Vincent. Hi, Sir Ray. I want to thank you and your team for your lectures and words of encouragement. I passed the NCLEX in 69 items. Tapos meron pa siya sinabi, correction, 60 items po. That's the minimum now. Kasi yung 15 items to make it 75 is now considered as a pretest. It's given as separate from the main test. So the 15 items pretest is not scored. So because of you, a lot of opportunity in my life has opened. Hope that you'll produce and help more future USRNs. Thank you, Vincent. Okay. Once again, say, I believe I will pass. And here's Daylin Cross from Tabaco City, Albay. Thanks a lot, Ma'am Selena, and to all Gapos professors. Kung ano tinuro nila, lalo na yung quick fix, which is free for everyone. You can watch it at your convenience, na lahat complete recipe na. Okay? So, let's talk about why NCLEX. Okay? Why? Because it's the only test that would help you land a career as a nurse in the United States. It's either you pass it or not. So if you want to have your great American dream fulfilled, take the NCLEX. When is the best time? Well, according to the State Board of New Mexico, you need to take it within the first 2 years after graduation. According to their studies, those who take it long after they graduate would eventually have lesser, okay, percentage of passing. So kailangan, within 2 years after graduation, mag-NCLEX ka. Kasi ang sinasabi nila dun sa bagong study, ang guidelines nilang bago ay, if you don't pass the NCLEX, or if you don't take it within 2 years of your graduation, they will need to ask you to submit proof of a refresher course. Okay. Where to take the NCLEX? Okay. There's a lot of myth. Maraming nagsasabi, take it in the Philippines, take it in Hong Kong, take it in the US. Well, I did an experiment myself. Okay. I took one of my NCLEX exams in Hong Kong. I took the other one in Florida. And another one, I was in New York. Okay. So lahat yan, tinignan ko. Lo and behold, isa dun sa tatlo, mas madali siya. So ibig sabihin, sir, merong location na mas madaling NCLEX. Yes, you have to send me an email, so I would tell you which one. And that's what I'm recommending also to my students based on their scores from our assessment test. Okay, how? Ito ngayon, ang hahabaan ko ang discussion. There are two main concepts that are really covered on the NCLEX, okay? Although there are 8 categories of nursing care that you need to be familiar with, specifically which concepts are covered in each of those 8, but today we will zero in on the 2 most common concepts and then integrate a little of everything in between. Are you ready? So those who are ready to pass the NCLEX, say, I am ready. Go. Those who will post it on our chat box will pass the test with minimum number of 60 and eventually shut it down. Ayan. Okay. Okay. Yan, ang dami-dami. Ready na pala kayo. O di, wag na tayong tumuloy. Joke. Tapusin na natin to. Living down ni Pinoy. Joke lang to naman mga to. Baka mapikon kayo ha. Okay. Now take note. Sabi nung isa, may nagpa-private message dito sa email ko. Sabi nung isa, Sir, ano yung kung saan madali yung NCLEX? Okay. Saan daw madali yung NCLEX? Okay. I will answer you through my email. Those of you, okay, who don't know my email, okay, here it goes. Okay. From my personal experience yan kung saan madali yung NCLEX. Okay. At saan na ipasa si Geraldine Cancino Banzon na Diyos ko, na 9 na taon na try sa California, ang binago ko lang yung schedule niya. Yun lang pala kailangan niya, pumasa na siya. Okay. Okay, sorry I don't understand this language. Okay, hi Depika Maharjan. Okay. Good afternoon to you everyone. Okay, so let me speak now in English because we have foreign participants. Okay, so let's move on. So let's begin with prioritization. Okay, now when you speak of prioritization, the concepts under this would be establishing priorities, triaging, or sorting clients. Now, the most important thing that you have to understand is that when you deal with this concept, your answers can never be a product of memory work. Your answers should be a product of your reflective skills and ability to analyze questions properly. Now, the question is, How do we go about analyzing questions properly? Now, this is where functional concepts would come in handy. Are we ready? So, the first prioritizing strategy is get down to the root cause of a patient's problem. Most of the questions that you will encounter for the NCLEX RN would be asking you which of those things do you need to prioritize based on the pathophysiology of a condition or a disease. And to do that, okay, let's have a sample question. Okay, here we go. A client is being treated for mixed edema coma has the following doctor's order. So we need to click on the exhibit. Okay, so the doctor's orders includes IV glucocorticoids, IV levothyroxine, 200 to 400 microgram loading dose, liothyronine, 5 to 20 microgram initial dose, followed by 2.5 to 10 microgram every 8 hours, and triiodothyronine. And then you have the question, which doctor's order should the nurse administer first? And then you have 4 options: IV glucocorticoid, IV levothyroxine, triiodothyronine, liothyronine. Remember, colleagues, this question is difficult because it's asking you to do 3 things. 3 things. 1, it's asking you to answer a question. Okay. Second, it's asking you to interpret the data that you have in the doctor's order. And third, it's asking you to relate the data to the question. That's a little complicated. This is what we call a chart exhibit question, okay, which is a miniature of the next generation NCLEX type of questions. Now, okay, what's the strategy? First, deal with the main diagnosis mentioned in the stem of the question. The main diagnosis is about mixed edema coma. Mixed edema coma is a complication of hypothyroidism. And in mixed edema coma, the patient would usually have difficulty breathing. And that's secondary to muscle weakness, which could be associated with adrenal insufficiency. Now, so to address the need to strengthen the breathing of the patient, it would need you would need to address the weakness, which simply means you need to ensure that your treatment will strengthen the muscles of breathing of the patient. How do we go about that? Are we first going to administer your thyroid supplements, okay, levothyroxine, triiodothyronine, or liothyronine, or are we first going to administer glucocorticoids? Now remember, you can answer this using a functional concept. According to the American Thyroid Association, when a patient with mixed edema coma experiences respiratory difficulty, you first need to strengthen the muscles of respiration. And to do that, you need to administer the steroids first. Okay? So therefore, the answer would be IV glucocorticoid, or number 1. So the functional concept that guides our answer to that question would be glucocorticoids help prevent adrenal insufficiency in patients with mixed edema and help restore muscle strength to promote respiratory function. So it's always the steroids before the thyroid supplements. Okay, so let's move on. Therefore, if you are given a disease, what should be your focus when you are studying? The first thing that you have to remember, for example, in disseminated intravascular coagulation, what should be your priority? Remember that in DIC, a common manifestation would be bleeding. But you would also wonder that in clients with disseminated intravascular coagulation, the patient is being given an anticoagulant, which is your heparin. So why is that so? Why are we giving anticoagulant when the patient is bleeding? Because the cause of the bleeding is systemic clotting. Because of the systemic clotting, the patient ran out of the clotting factors. So what resulted? Bleeding. Therefore, in order to stop the bleeding, you first have to initially stop the clotting. And the best way to stop the clotting is to administer an anticoagulant. So if you'll be asked what is the priority for a patient with disseminated intravascular coagulation, the answer should be to prevent clotting. Okay? And the drug that you will actually anticipate would be your anticoagulants. Examples would be heparin or enoxaparin sodium, which is a heparin derivative. Now, what about in pancreatitis, autodigestion of the pancreas, self-destruction of the pancreas? Now, remember, you have here itis, which indicates that there is inflammation. Now, the priority before you address the pain in pancreatitis is to rest the organ. For example, in a patient with gastritis, how do you rest the organ? You keep the patient NPO. Now, the pancreas is also responsible for releasing enzymes that would aid in digestion. Therefore, if you keep on eating, then you're not promoting rest of the pancreas. Therefore, initially, to promote rest of the organ, keep the patient NPO and then manage the pain. So that's the priority intervention for pancreatitis. Now, what about for schizophrenia? The main problem in schizophrenia would be excessive dopamine. The excess in dopamine increases nerve impulse transmission, leading to an altered thought process. So what will you address first? Is it the false belief of the patient, the delusion, or the altered thought process? It's the altered thought process because it's the root cause of the delusion. So always remember to get down to the root cause of the patient's problem. And then we have bipolar manic episode. Now, psychodynamically speaking, a manic patient is deep inside depressed. They are suffering from depression, but the way how they manage their depression is through the defense mechanism of reaction formation. That brings me to a question. Do you need to study defense mechanisms for the NCLEX? There are times that these basic concepts are being asked. So do not completely discount that you need to understand and remember the defense mechanism. So what happens now? In a bipolar patient, deep inside they're depressed, but they express the opposite of the real feelings. That's reaction formation. That's why they become hyperactive. So before you even deal with the hyperactivity, get down to the root cause of the problem, which is depression. Okay? And next, last but not the least, would be agoraphobia or social anxiety disorder. Now, agoraphobia is, etymologically speaking, when say phobia, fear, agora means market, fear of the marketplace, or fear of a crowded place. Now, if you speak of the fear of a crowded place, what is the common characteristics of patients with agoraphobia? They are usually patients who do not want to go out of their house. They want to stay home. But how would you know that they are improving? They are improving if they try to attempt to get out of their house. How do they do that? When they hold the knob of their door, they would usually have palm sweating and palpitation and all the signs of anxiety. Therefore, what is the root cause of the problem of agoraphobia? It's anxiety. So what is your priority? Manage the anxiety. Now, how is agoraphobia different from social phobia? In both instances, these patients with agoraphobia and social phobia love to stay home. Okay? The difference is a patient with social phobia has fear of public embarrassment. A patient with agoraphobia has fear of public places. So if you have a patient with agoraphobia or social phobia, a common characteristic, they love to stay home. What is the cause? Because of their anxiety. So what's your priority? Manage the anxiety. So if you'll be asked what is the priority medication that you anticipate to be given to the patient, then it's your anti-anxiety agents. Okay. Next, let's move on. Prioritizing strategy number 2, uncover the hidden concept. And you would say, what is a hidden concept? Sometimes, okay, there are concepts on the test that we're not familiar with, we're not familiar of. What do we do? Don't sulk and cry. The most important thing is be familiar with concepts that we could actually say hidden. Okay. What is an example of a hidden concept? Let me actually present to you a sample question. In planning the care of a client with norovirus infection, which of the following nursing diagnoses should be considered as the priority of the nurse? If you don't know what norovirus infection is, then you're done. That's what I'm trying to talk about. Sometimes they, instead of saying diarrhea, they say norovirus infection, rotavirus infection. Those are just plain and simple diarrhea. But that's what makes it difficult for the NCLEX. to understand, because some people would say, oh, you take the test, there are a lot of new diseases. These diseases are not new. It's such that we don't know the terminologies that they use to describe the disease. And on the NCLEX, we have such a thing as syndromic approach to question analysis. What do you mean by syndromic approach to question analysis? When you say syndromic approach to question analysis, you are not given labels. You don't see Addison's disease. You don't see Cushing's disease. You don't see Graves' disease. You don't see hypothyroidism. You don't see hyperthyroidism. What you will see would be groups of symptoms that define the disease. That is why it's up to you to interpret the syndrome and think about the disease. So it's assessment centered. The questions are assessment centered. That's what makes it difficult. So the test is in itself not difficult if you are prepared for the kind of questions you will meet in the test. So now that we know that norovirus is just plain and simple diarrhea, what do we do next? Let's answer the question. What nursing diagnosis should be considered the priority of the nurse? Is it 1, impaired skin integrity? Is it 2, fluid volume deficit? Is it 3, altered nutrition less than body requirement? Or is it 4, anxiety? It's easy. We know for a fact that in diarrhea, you are having loose bowel movement. That's usually very, very fluid. So the priority nursing diagnosis would be definitely fluid volume deficit. And that's your priority for norovirus. Now, to make it easy for you, here are the things that I'd like to highlight. Now, please do pay particular attention to this. We're going to give out my PowerPoint presentation in PDF file through your email. So you're going to have a copy of this. You don't need to write down anything right now. You just have to listen so that we maximize your our learning session in terms of the digested concepts that you will have for today. So let's begin. So if you see norovirus or Norwalk virus or rotavirus on the test, think about diarrhea. Okay, so if you see Wilson's disease, okay, now this is something new to me, sir. Now, the presenting symptom of Wilson's disease could be similar to that of a patient with liver cirrhosis. Don't you know that? A patient with Wilson's disease could present with enlarged abdomen, something that we get to see in the mirror after we take a bath in the morning. No, kidding aside. You would see ascites, okay? Then the patient would also have muscle wasting, but there's some unique characteristics that will make you think that the patient is not having liver cirrhosis, but the patient's having Wilson's disease. And what is this? Kayser-Fleischer ring. Kayser-Fleischer ring is found in the eyes. It's around the pupils. It's a rounded rings that could be brownish. It could be greenish. It could be bluish green. And this is due to the accumulation of copper. Why? Because your Wilson's disease is actually a condition that leads to the degeneration of either the liver and the eyes. Okay? And this is because of retention of copper. What could have caused the retention of copper? Well, the disease is genetically transmitted. It is transmitted autosomal recessive, which means both parents have to become trait carriers for them to be able to transmit the disease. So when you see Wilson's disease, think about copper poisoning. Okay. And when we speak of poisoning, like in lead poisoning, okay, you need agents to facilitate the excretion of the excess copper in the body. Yes. So is there a cure for Wilson's disease? No, there's no cure. But are there treatments? Yes. What's the difference between a treatment and a cure? Well, a cure could bring back the person to a normal state of health. And that ain't gonna happen in Wilson's disease because this is genetically transmitted. But we have available treatment or medications that could help facilitate the excretion of excess copper. And this includes your penicillamine. Now, your penicillamine, you need to assess the patient if they're allergic to penicillin before giving this medication. Your penicillamine could promote excretion of excess copper, but you have to take it with vitamin B6 because it has a tendency to diminish vitamin B6 like INH, okay? Trianterine could also be given to promote excretion of copper and of course, a supplement with zinc. in essence, you have to know what Wilson's disease is all about before you are able to identify the priority. Therefore, knowing that Wilson's disease is genetically transmitted, if you will be asked on the NCLEX, to whom would you refer the patient? Then you need to refer the patient to a geneticist. Because you have a patient who is having a genetically transmitted condition. Okay? Okay. So if you'll be asked, what is a complication of Wilson's disease? It could be liver damage. Then eventually it could also damage the brain. When copper accumulates, it could also damage the kidneys. So eventually there is copper poisoning. Okay. Anybody who knows about Alport syndrome? Okay. When you see Alport syndrome, think about nephritis. Okay. So is nephritis similar to acute glomerulonephritis that we actually encounter? Okay. Take note. When you say acute glomerulonephritis, that's usually secondary to group A, streptococcal infection that begins with a sore throat, caused by either a sore throat, infection with impetigo, and scarlet fever. Okay, acute glomerulonephritis is acquired. Alport syndrome is genetically transmitted. Okay, now what is the pattern of transmission? Your Alport syndrome could be transmitted in 3 different ways. 80% of Alport syndrome is transmitted by X-link pattern, which means it is transmitted by the mother to the son. 15% is transmitted by autosomal recessive, and the remaining 5%, they get it from autosomal dominant transmission. Okay, now, how would we differentiate Alport syndrome from acute glomerulonephritis? First, let's talk about the similarity. Since Alport syndrome causes nephritis, there is hematuria. Okay? Hematuria, the presence of blood or RBCs in the urine. So the patient will describe the urine as tea-colored urine, cola-colored urine. So if you see tea-colored urine, cola-colored urine, think about Alport syndrome, think about acute glomerulonephritis. So if you'll be asked on the NCLEX, what symptom is common in a patient with Alport syndrome or acute glomerulonephritis? Think about hematuria. But what if it's the other way around? What is the difference? What symptoms will make Alport syndrome different from acute glomerulonephritis? Then that's when you need to know the organs that are affected in Alport syndrome. So since Alport syndrome causes nephritis, it affects the kidneys. That gives rise to hematuria. It also affects the ears. Okay, so there's going to be hearing loss. Okay, and it also affects the eyes. So there's vision loss or eye abnormality. So therefore, what symptom will differentiate Alport syndrome from acute glomerulonephritis? You have impaired sensory function, specifically the sense of sight and the sense of hearing. Once again, since Alport syndrome is genetically transmitted, to whom would you refer the patient? To a geneticist. But this time, you also need a nephrologist because the kidneys are affected. You also need a doctor specializing on disorders of the ears, EENT specialist, okay? And of course, the eyes. Okay, so an ophthalmologist. What's the difference between an ophthalmologist and an optometrist? An optometrist is a doctor of optometry who is responsible for identifying, okay, the grade of glasses that you need. An ophthalmologist is a doctor of medicine who specialized in eye disorders. Okay, so let's move on. Torsado point. Okay, torsado point is an abnormal EKG pattern characterized by ribbon-like ECG reading, and this is associated with tachycardia. Now, the treatment that's usually done for patients with torsado point would be the administration of IV magnesium sulfate. Okay, next. What about pulmonary embolism? What should be the focus? What should be the priority? Well, prevention of clot formation. Pulmonary embolism could be associated with 4 common risk factors. Remember the code TAOS. Okay, first T is trauma, A, aging, O is obesity, and S, smoking. Okay, How would you know that the patient's having pulmonary embolism? The most common and the first sign would be your sudden shortness of breath. Okay, then eventually the patient develops palpitation, coughing, and then the blood pressure goes down and the patient starts to faint. So what do you need to remember about pulmonary embolism? Prepare the patient for a diagnostic test called duplex ultrasound, which facilitates the assessment of the blood flow. And then anticoagulants will be administered. Remember, anticoagulants will not dissolve the clots. It will help prevent the enlargement of existing clots and the formation of new clots. And in essence, eventually, you will also expect a client with pulmonary embolism to receive fibrinolytic agents that will help address the clot formation. So this is in a nutshell, a summary of the trends that I'd like you to focus on when you are preparing for the NCLEX RN. So what is important for you to know, therefore, is you have to ask yourself, how will I study the concept? The how is as important as the what. Okay, so let's move on. Prioritizing strategy number 3, know who needs an intervention first. Okay, a lot of times you could have heard your friends who have taken the NCLEX as telling you, be particular with questions that would ask you, which client should the nurse see first? Which client should the nurse attend to first? Which client needs to be evaluated first? Okay, if you specifically pay particular attention to these types of questions, you can use prioritizing strategy number 3. Okay, so remember the TAOS for pulmonary embolism, that's trauma, aging, obesity, and smoking. Okay, I hope you got it, Alfredo. Okay, now let's move on. Prioritizing strategy number 3 states, know who needs an intervention first. Okay, so here is a functional concept. What is a functional concept? It could be a word, a phrase, a sentence, or even a paragraph that would give you a sense of direction on how you deconstruct the questions in the test. So here we go. Here's a sample of a functional concept. Elderly clients above 65 years old are at higher risk to develop complications from influenza. Therefore, using this functional concept, can we therefore conclude that if we are going to be asked which client should be our priority for vaccination for influenza, could we answer and look for one who is an elderly? That's what I'm trying to tell you guys. That's the advantage of knowing your functional concepts. By the way, those of you who may want to have a thorough knowledge of functional concepts, I have it all in my YouTube channel, Gapos Mentors. Please do subscribe and don't forget to hit that like and bell notification button so you'll get notified when I upload videos, usually 2 to 3 times a week. Okay, and then you send us an email so I can give you a copy of my PowerPoint presentation in all those videos that you chose to watch. Okay, now let's try answering a sample question. Which of the following patients should be the priority for administration of influenza vaccine? This is what I'm trying to tell you guys. What did we say a while back? Functional concepts, the elderly, 65-year-old and above. So if we take a look at the age, that is the main qualifier. So with this question, no further analysis needed. Look at the age, somebody is above 65, that's your priority. So the answer to this question would be number 1. Okay, now, pregnant women can get the flu vaccine. In fact, they're also considered as priority alongside with the elderly patients. Most people with egg allergy can get a flu shot. Now, this is an update. It used to be that since your influenza vaccine is inoculated from duck eggs, anyone who has an allergic reaction when eating eggs would usually not be given an influenza vaccine, but not anymore. Those with egg allergy are just advised to get their flu shot at a facility that can potentially address problems that could result from an allergic reaction triggered by the injection of a flu vaccine. Okay, so here are functional concepts on influenza vaccine from the National Vaccine Advisory Council and Advisory Committee on Immunization Practices. Remember this, class. Priority for influenza vaccine includes the 3H. The first H would be household contacts for severely immunocompromised persons. When you say household contacts, these are the people who are providing care to the patient, to whom the patient is living with, okay? And when we talk about immunocompromised patients or persons, these are patients with AIDS, transplant recipients who are on steroids, or incident cancer patients. Incident cancer patients are newly diagnosed patients. So if you'll be asked who should be a priority for the vaccination of the influenza vaccine, you can choose as your correct answer the household contact or the caregiver of a newly diagnosed cancer patient. And then household contacts of children below 6 months, and of course, healthy children from 6 to 23 months of age. So don't forget the 3H as your priority for influenza vaccine, apart from the elderly and the pregnant clients. Now, let's move on to prioritizing strategy number 4. Here we go. When assigning patients to a private room, prioritize. Now, more often than not, you would hear your friends telling you, well, you have to know how to prioritize which client will you place in a private room, which client is a priority for the negative airflow room if you only have one left, okay? And what do you do if you have only one private room and you have two patients with infectious conditions? Cohort them together. If both patients have tuberculosis and there's neither of them suffering from a secondary infection that could potentially infect the other patient, you can put the two patients in one single private room with negative airflow. So the priority for a negative airflow room would be the patient with tuberculosis, if you only have one left. And then patients who are immunocompromised, like those who are having chemotherapy or having steroid therapy, with poor immune system, with leukemia, with pancytopenia, with AIDS, they have to be in a private room. And patients who require a noise-free environment should also be in a private room. Who is a patient who requires noise-free environment? A patient who is prone to seizure, the patient who's having meningitis, because remember, in meningitis, they would have photophobia. They are sensitive to bright light, so they need a darkened room. They have phonophobia. They're hypersensitive to sounds, so they need a room away from the nurse's station in a quiet part of the unit, okay? Now, it's also important that you need to remember, you have to know how to differentiate which type of meningitis requires a private room. Viral meningitis requires standard precautions, therefore no need for the private room. Bacterial meningitis is the type of meningitis that requires a private room. Now the question, how will I know that it's bacterial meningitis? The outstanding manifestation with the presence of petechial rash, bluish, purplish, reddish rash spread on the trunk. That differentiates bacterial meningitis from viral meningitis. Are we saying then that we don't have rashes in viral meningitis? No. In viral meningitis caused by enteroviruses, they have a rash, but it's not petechial rash. So remember, it's the petechial rash that differentiates your bacterial meningitis from viral meningitis. So it's the patient with bacterial meningitis that should be considered as a priority for the private room, because, okay, these patients, listen up, are having phonophobia and photophobia. Okay, way to go. So please pay particular attention to those most important things that I'm trying to highlight, okay? Kindly reserve your questions and I'm going to answer them towards the end of my presentation. So let's try answering a sample question related to this concept. Shall we go? Okay. Which of the following clients should be a priority for placement in a private room? An adult male with hepatitis C. Now, all types of hepatitis, A, B, C, D, E, okay, would require standard precautions. When you implement standard precautions, you don't need a private room. So for the first one, okay, sorry for that, that's an X. The adolescent female with bubonic plague. Again, bubonic plague requires standard precautions. You don't need a private room for that. The school-age child with aspiration pneumonia. Aspiration pneumonia is not infectious. You don't need a private room for that. An elderly female with absolute neutrophil count of 1,200. The normal absolute neutrophil count is 2,500 to 6,000. Therefore, the absolute neutrophil count of 1,200 is simply low. which means that the patient is prone to infection. Now, this female elderly patient could be taking clozapine or clozaril. That's an atypical antipsychotic that's notorious for causing leukopenia. That's why you need to check the absolute neutrophil count of that patient taking clozapine on a weekly basis. So we put a check. An adult pregnant female with preeclampsia, they're prone to seizure. We said a while back that these patients are prone to seizure, needs a private room. We put a check. A middle-aged male with afternoon low-grade fever with blood-streaked sputum. This is what I'm trying to tell you guys. This is a syndromic approach of presentation of tuberculosis. There is in no way that you see the label tuberculosis in option 6, but you have the defining characteristics: afternoon low-grade fever and blood-streaked sputum. We're talking about TB. They need to be in a private room because they require airborne isolation precautions. So the answers are 4, 5, and 6. Way to go. So those who are learning and they think they will stop the NCLEX at a minimum number of 60, say yes on our chat box. Go. If you do so, you're going to shut down the NCLEX at a minimum of 60. Please do call my attention if I'm moving a little faster, okay? That's my normal pace. I'd like you to learn, colleagues. I'd like you to learn the proper way of doing the NCLEX. Okay, thank you so much to everyone. And I'm sure yes, you are enjoying the class. Okay, let's move on to prioritizing strategy number 5. When you prioritize, focus on patients with ABCD symptoms: aspiration risk, breathing difficulties, cardiac arrest, and drooling. Okay. Filipinos, yun bang drooling? Yun ba yung dalawa tungin? Hindi, duling yun. That's just a Filipino joke. Okay. Pardon me for our international participants. Okay. Which clients would usually be prone to aspiration? Okay. We have infants. We have patients with Parkinson's disease. We have patients with multiple sclerosis. Okay. Which patient would have breathing difficulties? Patients with myasthenia gravis, patients with COPD, patients with asthma, patients with bronchitis, patients with emphysema, okay? Patients who are at risk for cardiac arrest, okay? So those who have a history of MI with flatline on the EKG and drooling or excessive salivation, which could be an indication of Parkinsonian crisis, okay? Parkinsonian crisis is a complication of Parkinson's disease. And the common finding would be drooling. Now, so whenever you see drooling, think about risk for aspiration. So if you'll be asked, what is the priority nursing diagnosis for a patient with drooling? Think about risk for aspiration. You'll never go wrong. Okay, now let me breathe life into that strategy. Let's try answering a sample question. Which of the following clients is the priority of the nurse for assessment of risk for aspiration? 21-year-old with abnormality of cranial nerve 1. Next, 30-year-old with impairment of cranial nerve 9. Next, 37-year-old with damage to cranial nerve 2. And last but not the least, 19-year-old with tumor of cranial nerve 8. Okay. Now, this is just actually plain and simple recall type of questions. I say recall type of questions because these are just based on cranial nerve assessment. If you know that cranial nerve 1 is your olfactory nerve, cranial nerve 9 is your glossopharyngeal nerve, cranial nerve 2 is your optic nerve, and cranial nerve 8 is your vestibulocochlear nerve, then this becomes a little more easy. But the point is, they did not spell out the name of the cranial nerve. They just labeled it cranial nerve 1, cranial nerve 9, cranial nerve 2, and cranial nerve 8. So what do we do with this? We do the process of elimination. So first, when you say cranial nerve 1, the olfactory nerve, that's responsible for the sense of smell. It doesn't have anything to do with aspiration. Then we move on to number 4. That's cranial nerve 8. Vestibulocochlear nerve is responsible for the sense of hearing and sense of balance. It has nothing to do with aspiration. We're left with 2 and 3. Cranial nerve 2, that's your olfactory nerve. Optic nerve. So optic nerve is responsible for the sense of sight. Therefore, you're left with option 2. And option 2 pertains to cranial nerve 9, your glossopharyngeal nerve, which together with your vagus nerve is responsible for swallowing and the gag reflex. Okay, now question. Will your patient experience hoarseness when you have an impairment of cranial nerve 9? Yes, because okay, cranial nerve 9 and cranial nerve 10, your vagus nerve, okay, would usually have okay, control over your vocal folds. But if you will be asked which of the two has a more direct effect on the vocal cords or vocal folds, then you will have to answer your vagus nerve. So whenever you hear your patient having hoarseness, okay? Filipinos, ano ba yung hoarseness? Yung ba yung pag nagsalita, ganon? No, hoarseness would mean there's um, a different quality of your voice. It becomes a little rough and it's no longer smooth and pleasant to the ear. So is it important, sir, that we need to study how to assess cranial nerves? Yes, because if I would highlight a trend right now, you have to know your functioning of cranial nerve 5, trigeminal nerve, cranial nerve 7, facial nerve, cranial nerve 9, glossopharyngeal nerve, cranial nerve 10, vagus nerve associated with hoarseness. Now, there's if you would have the opportunity to talk to your friends or maybe could have taken the test, they would ask you which cranial nerve is associated with Bell's palsy. Now that is usually associated to the damage of cranial nerve 7. That's your facial nerve. And it's characterized, Bell's palsy is characterized by pain and discomfort, okay, on one side of the face. It is usually treated with steroids. Okay, now, so with this question, what we did is that we tried to use the process of elimination hand in hand with a functional concept. So always remember, okay, you always have to relate your answer to the main topic of the question. So if you talk about aspiration, there could be difficulty in swallowing. And if you talk about difficulty in swallowing, there could be impairment of the glossopharyngeal as well as the vagus nerve. We don't have the vagus nerve here, but we have an option pertaining to the glossopharyngeal nerve, and that's option 2, which is the correct answer. Okay, so those of you who may want to go through my videos in my channel, Gapos Mentors, please subscribe and don't forget to hit that bell notification button so that you'll get notified when I upload my videos twice or thrice a week. You can share it to your friends, have the mission to help others pass the NCLEX through the lessons that I create and the content I create, which is for free. You can request for PDF files of the lessons that you choose to watch on my video. If you want to ask from me a created program for you, then please send me an email through my email address, gapusray@gmail.com. So you would notice that one of the most watched videos would be assessment of cranial nerves. So those who are taking the NCLEX are watching that a lot. And of course, they're also watching EKG interpretation for the NCLEX RN test taker, okay? So as much as possible, what is important is you know what to study. That's the what of NCLEX. Know what to study, and you have to know how to study for that specific concept. Okay, are you learning, class? Okay, answer me. Those who would put their answer in the chat box would actually shut down the NCLEX at minimum number of 60. Are you learning? Okay, just answer me. It doesn't have to be a yes all the time. You could type yes or no. Are you learning? Yes or no? Come on, go. Okay, enter your answers to our chat box. Okay, anybody home? Come on, are you learning? Yes or no? There they go. There's certain log. They are learning it. Okay, thank you very much. I just would want to find out if you are still home. Let's move on. Okay, prioritizing strategy number 6. And we're now number 6. Okay, always remember this. It's kind of easy. Learning, yes, definitely. Thank you so much, Alfredo. Thank you, Annabelle. Thank you, Katrina. A manifestation that indicates a complication or adverse reaction is a nursing priority. But what is difficult is, when will a complication be considered as an adverse effect? Because a side effect is not a priority when we're talking about drugs, because all drugs have main effects and side effects, like the pills. Some people don't want to take the pills, the contraceptive pills, because they don't want to have the side effect, which is weight gain. They want to remain sexy. But if you don't take the pills, you wouldn't have the side effect, but you would have the front effect. You'll get pregnant. So what would you want? The side effect or the front effect? Okay. So always remember, all drugs have side effects. Okay. Because a drug that has no side effect has probably no main effect at all. Now, the question is, what do I prioritize? The side effect or the adverse effect? Because sometimes these two could be interchanged when we study. Listen to this class. If a patient who's taking, for example, an antibiotic like rifampicin could be having nausea and vomiting as a side effect, okay? Will you consider the patient as a priority? Nuh-uh. But if a patient is having nausea and vomiting secondary to lithium, and the lithium level is already at 1.8 milliequivalent per liter, do we consider the patient a priority? Yes. Because nausea and vomiting is an adverse effect of lithium, which could just be a side effect of antibiotics. That's what I'm trying to tell you guys. You don't memorize that all nausea and vomiting are considered as priority. It depends on the context. If nausea and vomiting is an adverse effect, then it's your priority. If nausea and vomiting is associated with theophylline toxicity, when you have theophylline levels above 20 micrograms, then that's the time that you consider nausea and vomiting as your priority. But if it is a side effect, it's not your priority. Once again, let's give life, okay? Let's breathe life into this strategy. Here's a sample question. Which of the following clients should the nurse evaluate first? Okay, so this is a type of prioritizing question that is stated in a different manner. Here we go. A 55-year-old client with COPD, okay, and you have here a complaint of cough. Then 67-year-old client with emphysema, okay, with bronchitis, with emphysema and bronchitis with dyspnea. Then you have your 63-year-old client with barrel-shaped chest with rusty sputum, and a 61-year-old client with history of chronic tobacco smoking with tachypnea. Look, all of them are above 60, which simply means they're all elderly patients. And look, even if the way how each of these patients is described in relation to their conditions are different from the other, one from the other, if you are going to think about this, all of these patients are just suffering from COPD, because COPD includes emphysema and bronchitis. So the patient in option 2 is also having COPD. And COPD eventually leads to barrel-shaped chest, the increase in the anterior-posterior diameter of the chest, which is evident in the patient in option 3. And of course, in COPD, you will find history of chronic tobacco smoking, the #1 cause of COPD. Therefore, the way to do this is analyze. Cough is expected in a patient with COPD. A patient who exhibits a manifestation that's typical or expected in a disease is now a priority. That's a functional concept, my trademark. Next, 67-year-old with emphysema and bronchitis with dyspnea. Dyspnea is expected in COPD, so this patient's not the priority. Then you have the 63-year-old with barrel-shaped chest with rusty sputum. Rusty sputum indicates bacterial pneumonia. That is a complication. We can consider number 3, but we still need to read through and analyze option number 4. A 61-year-old client with history of chronic tobacco smoking with tachypnea. Tachypnea is expected in a patient with COPD, so this patient is manifesting a manifestation that's typical of a disease. Therefore, the priority for this nurse should be the client with rusty sputum, and that is number 3. Okay. Now, if you are given a list of diseases, like for example, Addison's disease with severe hypotension, that would mean the patient's going into Addisonian crisis. So what is your priority? Check the blood pressure, like a patient with pheochromocytoma. But a patient with pheochromocytoma, there is usually a hypertension. So not hypotension, but in the same way as that of a patient with Addison's disease, in both conditions, your priority is to check the blood pressure. Next, pernicious anemia, okay, deficiency of vitamin B12 that results to, okay, the presence of glossitis, okay, or the reddish tongue, okay, beef red tongue, and then tingling sensation in the fingers and toes that indicates paresthesia. The patient would say, I'm having sensations of pins and needles in my arms and my toes. That indicates nerve damage, which is a complication of pernicious anemia. Remember, in patients with pernicious anemia, they would usually receive vitamin B12 for the rest of their lives, and they will have to receive it injectable form because they don't have the intrinsic factor to absorb vitamin B12 in their stomach. Next, burns. Burned cells would usually release potassium into the blood, leading to hyperkalemia. Hyperkalemia increases the risk of the patient for palpitation. Okay, next, myasthenia gravis with severe muscle weakness. This indicates myasthenic crisis in which the problem is ineffective breathing pattern. Remember, myasthenia gravis could have cholinergic crisis as a complication, okay, due to administration of medications frequently, so over medication. But if the patient is under medicated, they develop myasthenic crisis, okay, that would actually result to muscle weakness leading to ineffective breathing pattern. So your priority for patients with myasthenic crisis would be administration, okay, of neostigmine plus, okay, monitoring of the breathing of the patient, because the patient would have ineffective breathing. And diabetes insipidus, characterized by a urine-specific gravity less than 1.005, and the patient will have, think about this, almost 21 liters of urine per day. Because of polyuria, okay, they release potassium in their urine, so they will have dehydration and hypokalemia. So you have to focus on the common complications of common disease conditions. I am brave to say now, those who are taking the test this month, I challenge you, read through what I'm highlighting and come back to me after you take your test and tell me if you encounter these conditions or not. I'm brave enough to challenge you. Okay, so what is important at this point is that you have to know how to bridge the gap between applying your strategies and combining them with the concepts that you need to remember for your test. Okay, so let's move on. Prioritizing strategy number 7, okay? To make way for a vacant bed during major disasters, consider discharging the following clients. 3Ds. The client who delivered 24 hours ago, the client who is due for discharge within the day, and the client who is done with the diagnostic test and is not bedridden. Once again, let's breathe life into this strategy. Let's try answering a sample question. After the earthquake, the nurse has finished assessing the clients in the ward. Which client should the nurse discharge first to make way for a new admission? A client who delivered by cesarean section 4 hours ago? No, we said a while back, it has to be 24 hours, okay, after the delivery. We can't discharge this patient. Client with quadriplegia, post-CSF analysis, quadriplegic, bedridden, and CSF analysis that they will usually have lumbar puncture, so that would require them to be staying in bed for 6 to 8 hours after the procedure. We can't discharge this patient. A client post ultrasound, well, ultrasound will not require you to discharge the patient, okay, to keep the patient on bed rest rather, so we can discharge this patient. And number 4, a client who is due for discharge the next day. We said a while back in our guidelines, we can discharge the client who is due for discharge within the day. So the best answer is number 3. Talk about the shortest among the options. Okay, I hope you're learning, class. And prioritizing strategy number 8. When deciding which patient is a priority for transfer to a burn unit, consider the patient's age and degree of burns. Don't forget about this guideline. So if you are asked to prioritize which client should you consider as a priority to transfer to a burn unit, consider the age. So the elderly, okay, is usually a priority because they're prone to dehydration, and degree of burns, okay? If the elderly has a 3rd degree burns, okay, that's more than 5% of the total body surface area. No questions asked, no debates. That's your priority for burn transfer, okay? So let's try answering a sample question. In the emergency department, which of the following client who were admitted, which client will the nurse consider as a priority for referral to a burn unit? 49-year-old client with 2nd, 3rd degree burns, okay, in the lower anterior leg. 2, a 9-year-old client with second and third degree burns, circumferential burn in the anterior side of the left lower arm and the posterior side of the right upper arm. 3, a 60-year-old with third degree burns of the entire left arm. And 4, a 15-year-old third degree burn in both palm of the hands. What is difficult with this question is, if you are just so tired and you cannot focus and you don't know how to interpret, because when you decide which client should be your priority for referral, you have to understand what the words anterior, posterior, circumferential, upper, lower, like for example, your entire right arm in the rule of 9 means you have 9% if this gets burned. But if it's just the lower arm, then that's just 4.5. It's just the palm, then that's just 1.5. If it's the entire arm, then that's 9%. So you have to understand whether each option is pertaining to the entire part of the body or just the lower part or the upper part, or whether it's circumferential, okay, or just on one side, just the top or the bottom portion. You have to be able to analyze and comprehend what the options are asking you about, okay? So here is our support. You have to know your functional concepts. The first one, third degree burns in more than 5% of total body surface area in any age group is a priority for transfer to the burn center, which means that if your patient has third degree burns and it's already present in 5% of the total body surface area, then no questions asked. That patient is your priority. Okay, then a client with second and third degree burns in more than 10% of total body surface area is a priority for transfer to a burn center if the patient is between 10 years old and 50 years old, okay, or below 10, sorry, and above 50 years old. A client with second and third degree burns in more than 20% of total body surface area is a priority for transfer to a burn center if the patient is between 11 to 49 years old. Okay, so to answer the question, let's recall the guidelines. If the patient has more than 5% burns, third degree in any age group, whether you have adult or elderly, that's your priority for transfer to burn center. If the patient is between 10 years old, sorry, below 10 years old and above 50, okay, they have second and third degree burns for as long as the burn is more than 10%, then could consider the patient a priority. Now, if a patient is between 11 to 49 years old and they have second and third degree burns, they are considered as a priority if they have more than 20% of their total body surface areas that are burned. And remember, second and third degree burns of the hands, feet, genitals, perineum, and major joints could also be considered when deciding which client should be a priority. So let's go back to the sample question. The first thing that you have to do, given these options, would be look for somebody who has third degree burns. That's what our guideline says. Do we have it? Yes, in number 3. And then look, if the third degree burn is more than 5%, you have left arm, the entire left arm, you have the word there, entire. So the entire left arm, this is in the rule of 9%, so that's more than 5%. So no questions asked. This is the answer. No debate. Okay, so the answer is number 3. Okay, so for those of you who want more of these prioritizing strategies, check on my quick fix number of 17, 18, and 19, and you will have a galore of prioritization questions, a galore of select all that apply or SATA questions, and I'm explaining it. You can request for a copy of the PDF file of my presentation. So always remember, class, when you study, you should know what to study and how to study. Do not rely on what your friends would just tell you about, because those things are based on their own interpretation. So I don't encourage NCLEX takers to ask people who have taken the NCLEX and then write down the questions. No, 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 because what they would remember will be tinted with their own personal interpretation and bias towards the question. So for all you know, those questions are not clearly stated. They would give you their own interpretation. So instead of just them getting the incorrect interpretation, there's now the two of you who are interpreting the questions incorrectly because you relied on a feedback. That's not the way to understand and prepare for the NCLEX. Okay? So thank you. This is session 1, and I suppose we're going to have a few minutes break before we proceed with session 2. I'll turn you over now to our facilitator for the day. Okay, those of you who would shut down the NCLEX at 60, say shut down at 60 on our chat box. Go! Shut down at 60 on our chat box. Go! Shut down at 60. Okay.